I didn't seek any professional help at the time. The medical advice was just to simply let it take its course, and then you'd be able to go on your merry ways, as the doctor had explained at the time.
A classmate told me that she had just discovered she was pregnant, and I said, I'm pregnant too. And it was this really awesome thing that we were able to share. Literally, as soon as I had that conversation, I went to the toilet and bam, that was the end of that, the beginning of the end of that pregnancy. And I remember I went back out into the classroom completely dazed, like, I think I'm losing this baby. I should go to the doctor, shouldn't I? Should I? I don't know, just didn't know what to do. And then I texted my husband and I said, darling, you better come, lots of blood.
I made sure that I went to, for one thing, a healer to see what that had been about spiritually, if there was any sort of insight that I could get there. And then also, once I got pregnant again, to have a fear release so that I could enjoy my pregnancy rather than worrying the whole time that something was going to happen again.
Whenever a patient is pregnant and starts bleeding, they must seek medical attention. If they have a midwife by then, they should go and see the midwife or a general practitioner. And if on the weekends, if that's not possible, if the GP practice is closed, then they should go to the nearest A&E or emergency department in whichever area they are.
For the very early pregnancies, before 8 weeks, if there is not much material in the uterus, increasingly women are being offered the option to manage it conservatively, so not to come into hospital but to await miscarriage spontaneously. Some women prefer that. Other women prefer to have a scraping of the uterus, a D&C, and especially if there's a large amount of pregnancy material, it's safer to do that.
One way of managing miscarriage is we give them medication to bring on the process so that, whatever pregnancy tissues are left in the patient's uterus can be expelled out.
I, first of all, chose the pills. I didn't really have a chance to go talk to other people about that, but I took them, and that I thought they worked, but they didn't. So I still had a little bit of the baby inside me, and I was starting to have cramps, and I was like, something's not right. So I went to the hospital, they did a scan and found that there was still blood supply going to that sort of area. And so I ended up having to have the D&C, or EPOC, which they call it.
If you get pain, bleeding, and particularly dizziness or a symptom of kind of feeling faint, like you might collapse, and you haven't known your pregnancy was within the womb, then you do need to contact a doctor relatively urgently, just in case you're having an ectopic pregnancy. And if you get extremely heavy bleeding or pain at any stage, you're going to want to seek help and get some advice, but also as to whether or not you have had confirmation that the pregnancy was in the womb or it wasn't, to rule out that risk of ectopic.
Once we got the information that we had miscarried Dougie, it was very, very fast. So we found out on the Thursday that our baby had no heartbeat, and on the Friday we were going in for surgery. So it was a very quick progression. There was no time to really adjust to emotions or feelings. We came home from the scan and we told the children. The next day we're ringing the hospital and they're saying, come in and we'll see if we can get your surgery done today. They talked to us about the options and everything like that, but there wasn't much discussion around what happens afterwards.
I didn't have any symptom. I just passed out twice. So I went to an after-hour clinic. It was weekend. And they checked me. They said everything seems to be fine. And when we went to do the ultrasound, then when we learned that that was a miscarriage. So they sent us to emergency. But we didn't know at that time that there was a pregnancy center in the hospital, and we were admitted towards the emergency system. And they treated us as their protocols, thinking that, okay, well, yes, you had a miscarriage and you should wait until your body naturally processed that. It was really hard to explain that we were like, it's not the miscarriage. And I remember there who told them that we are not here for free Panadol. So it took us a while. It was a bumpy road to get the right diagnosis.
The hardest thing is sometimes for us, because we're health professionals, is that we're often very, very busy people. And you might have 4 women who are miscarrying, you know, who are actually sitting there in your clinic or in emergency department. So for us, it's what we do every day, and we try and remove the emotions from our work that we need to do to make sure that the patient's looked after well.
Every woman who's pregnant will get a whole lot of blood tests done, checking for all sorts of different things. But one of the things they're checking for is whether or not you are rhesus negative or positive. And that's part of your blood type. So for example, if you're O positive, that means you're rhesus positive. If you're O negative, that means you're rhesus negative. And during pregnancy, it's important to know about that, because if you are a rhesus negative woman and you have a miscarriage, it's really important you get what's called an anti-D shot in the first 72 hours after the miscarriage, or even after a threatened miscarriage actually, so even after some bleeding that doesn't continue to be a miscarriage, because that will help prevent any issues with your next pregnancy.
So it's an immunoglobulin which we give patients who are Rh negative, because if the patient's partner is Rh positive, and if the pregnancy continues where they've had bleeding, some Rh positive cells can go into the patient's blood, and that can form antibodies, which can cause problems in the subsequent pregnancy. So when we give anti-D, we inhibit that whole process to cause problems in the subsequent pregnancies.
I was worried about my future pregnancies. What if I lose? What if I cannot have a baby ever again because of all this miscarriage and infection and then all the side effects that could have been avoided?